Hello friends, welcome to week 7 of our MOOC on climate change and disaster risk management. In week 6, we learn how emergency teams carry out search and rescue, provide first aid, and manage emergency reliefs, ensuring that survivors get safety, food, water, and shelter. Now, in week 7, we will move deeper into what happens after the initial chaos settles when the focus shifts from saving lives to safeguarding health. We will discuss public health challenges and disasters. During and after a disaster, there are three critical concerns: disease outbreaks, vaccination, and hygiene. When floodwaters recede after floods or the ground stops shaking after earthquake, the threat to human life often continues through contaminated water, poor sanitation, and the spread of disease. Let's understand how this happens and how smart public health measures can stop a disaster from turning into an epidemic. Public health matters in disasters. Asia, especially South and Southeast Asia, faces about 60% of world's major natural disasters. And within this region, India is one of the most disaster-prone countries. Every year, floods affect nearly 9 million hectares of land, earthquakes threaten more than half the country, and cyclones batter over 5700 kilometers of coastline. Disasters don't just destroy buildings, they disrupt lives and health systems equally. Water pipes break, food supplies stop, and people are crowded into temporary shelters, and even hospitals and clinics may be damaged. In such conditions, disease spreads fast. The danger is not from physical injuries, but from outbreak of infections that follow, like cholera, malaria, dengue, diarrhea, even measles and tuberculosis. That's why managing public health is one of the most important parts of any disease response. Disasters affect health both directly as well as indirectly. Direct impacts such as injuries, deaths, infections due to contamination of water and poor hygiene, poor sanitation, and overcrowded shelters can lead to outbreaks of cholera or dysentery. Hospitals and clinics themselves may be destroyed or lose power and staff. Indirect impacts develop over days or weeks, such as food shortages, malnutrition, mental health issues, and long-term illnesses. That's why public health teams must work alongside rescue agencies from the very beginning. Now let's look at some common reasons of disease outbreaks in disaster settings. Damaged pipelines or flooded wells pollute drinking water. Overcrowded shelters leads to faster spread of diseases like diarrhea, flu, COVID-like infections. Stagnant water becomes breeding grounds for mosquitoes spreading malaria, dengue, and chikungunya. When infrastructure is damaged, people miss routine vaccinations and treatments. Food shortages leads to poor nutrition, weakened immunity, especially in children and the elderly. Mental trauma leads to weakened mental health that lowers body's resistance to infections. Simultaneously, we will discuss the promptness and readiness of health authorities to prevent such outbreaks. India's National Disaster Management Authority (NDMA) has special guidelines to handle such biological disasters. It stresses on coordinated, technology-driven approach, combining rapid disease detection, data analysis, and formation of local response teams, as it was seen in 2018 Kerala floods. Massive rainfall contaminated water sources. Health officials quickly distributed doxycycline, a preventive antibiotic, to stop an outbreak of leptospirosis rat fever. Their timely action saved countless lives. Now the role of surveillance and rapid response in prevention of outbreaks. Quick detection is the first line of defense against epidemics. Disaster teams use disease surveillance systems to track new cases in real time. In India, this includes the Integrated Disease Surveillance Program, IDSP and Niti Aayog's Vision 2035, which aims for a tech-driven public health network. Health workers, ASHA staff, mobile clinics collect data daily and report it immediately, helping authorities spot patterns before an outbreak spreads. Modern tools like mobile dashboards, GIS maps, and AI-based analytics now assist in predicting where disease risk may rise next, such as stagnant flood zones or crowded camps. But surveillance alone isn't enough. It must be followed by quick action. Medical supplies, awareness campaigns, and clean water delivery to break the chain of infection. Now we'll come to vaccination and immunization during emergencies. After disasters, vaccination is one of the most powerful shields against disease. During and after disaster, routine immunization is disrupted due to shortage of vaccine supply and diversion of health staff in disaster management operations. This leads to outbreak of vaccine-preventable diseases like measles, diphtheria, and polio. To prevent this, emergency vaccination drives are launched, as it was done during Kosi floods in Bihar 2008. The government, UNICEF, and local health workers launched a massive measles vaccination campaign for all children aged 6 months to 14 years. They set up vaccination camps in relief shelters, used boats to reach cut-off villages, and maintained the vaccine cold chain even in flooded areas. The result? Large-scale epidemic was prevented, and this model is now studied globally as a success story in emergency immunization. In 2021-22, the face of COVID-19, through coordinated planning and indigenous vaccine production, Covishield and Covaxin, India delivered the world's largest vaccination drive, reaching even remote villages through the CoWIN digital platform. This success showed that with good logistics, data systems, and public trust, even the toughest immunization challenges can be overcome. Now coming to hygiene and sanitation during disaster emergencies. No vaccination or medicine can work effectively without good hygiene and sanitation. After disasters, open defecation, poor waste disposal leads to contamination of water sources and the spread of diarrheal and skin diseases. Maintaining wash, that's water, sanitation, and hygiene becomes essential. Let's recall the example of Cyclone Fani 2019 in Odisha. Over 16 million people were affected and 60% of the population practiced open defecation after sanitation systems collapsed. With help from UNICEF and local authorities, quick action was taken. Over 400 masons were trained to rebuild toilets and hand pumps. Damaged wells were chlorinated. Adolescent girls were trained in menstrual hygiene. Local communities built slow sand filters, a low-cost method to purify drinking water. This showed how public participation and simple local solutions can rebuild hygiene and dignity faster than any top-down plan. Today, India's low-cost mobile toilets, emergency wash programs, and digital hygiene education campaigns like those by WaterAid India are being replicated across flood-prone states. Disasters remind us that health systems must be as resilient as the infrastructure around them. Here are some new and promising directions India is taking. Digital health surveillance is being done using mobile apps and dashboards for early disease alerts, predictive analytics to map hotspots for vector-borne or waterborne diseases. Routine immunization should be strengthened so that no child should miss any vaccine even during emergencies. Citizens should participate fully in hygiene maintenance, vaccination awareness, and vector control. More health workers should be trained in disaster public health, and resilient hospitals, wash facilities should be built that can withstand floods and earthquakes. Each of these strengthen the chain that connects preparedness to public health safety. When health systems are ready, the community recovers faster. preparedness and promptness in taking action has saved lives, and it was witnessed during Gujarat earthquakes in 2001 and Kerala floods 2018. It proves that even in the toughest conditions, coordinated action between health departments, local governments, and communities can prevent epidemics. So, friends, as we have seen, managing public health during disasters is about stopping one disaster from leading to another. In our next unit, Unit 7.2, we will look at another equally vital aspect of disaster response, that is, mental health and trauma. We will explore how disasters affect people emotionally and psychologically, and how communities can heal together through care and support. Until then, remember, physical recovery begins with health, but true recovery begins when people feel safe, healthy, and hopeful again. Thank you and see you in the next session.